You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. This is a very interesting episode we're about to have. Ivan, I think you might know something about it. Can you go ahead and introduce today's guest?
Hi, I'm Ivan Zach, and I'm happy to introduce my colleague, Dr. Caleb Frankel. And I think I have to make a disclosure before this one because we're interviewing someone who built workflow optimization system, and I can't build or advertise one, so this is not promotional or to build it. But Caleb, it's a pleasure to have you on the show as we've been competitors, which is great, and I'm happy to have you here. What we know about Caleb is that he is a founder and CEO of Instinct Science. He is an emergency and critical care veterinarian at the Veterinary Specialty and Emergency Center in Philadelphia. And he has a degree of VMD from the University of Pennsylvania, Veterinary Business Management Certificate from the University of Pennsylvania. On the personal side of things, his wedding ceremony was followed by a Halloween masquerade reception. Very interesting. He carried a Dell Maxim 51 assistant in vet school as a way of keeping organized. And also, there's a fun fact that he shot a three-pointer while riding a donkey. We have to dive into that one right away. Welcome, Caleb.
Thanks for having me, guys.
How did that happen?
Yeah, let's get into go to the donkey first. We'll go back to the Dell Axum 51 in a minute.
Yeah, there's probably so much to explore there. The donkey. So I played basketball in high school, and I'm from a very small town in the mountains in Pennsylvania. You could call it Pennsyltucky, and they, this is probably a hokey, middle America kind of thing, but they did a fundraiser. At least back then, it was a thing where they'd bring in donkeys, and the senior students would play the teachers, and you'd have to ride donkeys while playing basketball. Probably PETA would not be very happy about this, but it was very humane treatment of the donkeys, and it was for a good service. And the donkey basketball, you'd have to be on the donkey when you made a shot, and that was the rule. And they told us, get close to the hoop. You're not going to make a shot, far away. And I was a 3-point shooter in high school, and so I took that as a challenge. And my first shot was from the back of the donkey, from the 3-point line, and sunk it. So that's my claim to fame.
Well, Caleb, I got to say that I don't think me and Ivan could have made this shit up. Like, you're serious right now, right? You're
I came on to just make up stories. Yeah.
Okay, good. Okay, perfect. And then what is a Dell Axum X51?
Oh, God only knows. So that's old technology, right? The Dell Axum is something I used when I was nerding out as a fourth year clinical student at Penn, when I was basically trying to be as efficient as possible using technology. But remember, back then there were no iPhones, so this is the Palm Pilot days. So it was probably a Palm Pilot competitor, I guess.
Well, that's very, very interesting. And so I guess we can include you in the nerd club, because I had
Totally.
a Palm Pilot as well. I remember working as a server in a restaurant and using the Palm Pilot to take orders and being made fun of by all the wait staff.
You still have one, do you? Oh, no, you use Android, which is pretty similar, isn't it? All right, let's switch to the question.
I'll leave that one alone.
So Caleb, I'll switch to the serious side. So I think it's really cool what you've started, and I compliment you. One thing that I kept thinking when I saw your product come out, obviously I was running SmartFlow at that time, and I was thinking that you've seen one product which was sort of new-ish idea if we don't take other whiteboards and things like that into account, and then you thought, I can do things better, or I can do things differently, or I can develop something that people will use. So I think that takes courage and innovation, and that's why you're here. So I want to hear what drove you to start Instinct, and what was the goal, and how far are you from getting there?
Yeah, great question. So, back in 2008, I graduated from Penn, and I got out into the real world. I did an internship at a specialty center in South Florida, and as a vet student, you don't really, or at least I didn't know what was going on out in the real world. You're just kind of laser focused on learning and surviving as a student and trying to be a budding clinician. And I remember getting out into practice. And at that time, it's a great practice in South Florida called Coral Springs Animal Hospital. And yeah, back in 2008, they won multiple Practice of the Year awards around that time. They were as innovative as they could be, trying every tool that they could.
What's his name? Sorry to interrupt you, but I remember the guy. What's
Dr. Lloyd Mizels. Yep.
Yeah.
He's an innovator. So he's a really cool guy, very cutting edge, started specialty medicine practice really in the 70s, which is, ahead of the time. But I remember getting into my internship and being just blindsided by the state of technology. And remember, this was back in 08. And, back then the iPhone was just a thing. So technology was different, right? But even back then, I had a background. I had actually spent some time in other industries. I worked as a consultant for a company called Booz Allen Hamilton in summers of vet school. And I learned what other industries were doing with technology, especially software at that time. And I remember getting out into the real world and just saying, my God, this is what we have. And I remember looking around to see if, there were other better solutions. It was all kinds of things. It was the PIMS, but it was all kinds of programs that we were using. And I became obsessed with it, to be honest. I'm efficiency driven. And even back then, I struggled to learn the medicine because I was so just distracted by the state of the tools we had, right? And so, in 2009, 2010, I'm one of those people who I don't do well if I'm frustrated. I'm unstoppable in a bad way. And so I remember just trying to tinker with everything I could. I mean, Google Drive and Sheets and Excel and Evernote. And I was creating all kinds of crazy things. Most of them failed. Some of them were winners to help with efficiency, and trying to get my colleagues out earlier, trying to get tools in place to help us practice better medicine, safer medicine. And that led to me writing a business plan. I knew, I'm a clinician, right? I knew nothing about business. I'll just put that out there. I am interested in business. I come from a family who knows about entrepreneurship, but not me. And I remember, just saying, I don't know what to do about this, so I'm going to write a business plan. And in 2009, 10, I wrote a business plan really for what would become Instinct, some 7 years later. But from then on, I did everything I could to try to get myself involved. I was on IDEXX's referral practice advisory board for several years, trying to make their products better suited for our environments. I started a blog to try to write about some of the things that we were doing that other people could do. And I never looked back. And, the story goes that in 2014, I was kind of interrupted in my path to starting a company where I was offered a position that really I wasn't qualified for at Brief Media. You guys know Clinicians Brief, the journal. So they had come across a blog post that I had written about, really just venting about my frustration that, of all things, Plums is not in an acceptable digital resource, right? And they, at the time, I didn't know this, were thinking about partnering with the author to build a high quality point of care, technology solution to Plums, and they were looking for a veterinarian to help lead that team. And I started consulting with them when they read that blog post, and then they eventually offered me a job. They gave me a job I wasn't qualified for, to be honest, which was director of new product development. And, I'm a learning animal. And so I just took that time to learn how to develop new products, commercialize products, sell, market, lead a team of engineers, software development life cycles. And from there, basically came back to the original business plan and said, this still isn't fully solved for where we're headed. And in 2017, we launched Instinct.
So I got to ask, when you launched Instinct, what did you think of SmartFlow? I'm allowed to ask.
You're allowed to ask, yeah.
You're like really pushing it there.
Who knew this would happen? First of all, huge respect for Ivan. Ivan and I were talking before this. Only Ivan and I know what it takes to do this, really, actually. It is, really what Ivan and I's products do. One of the practices we installed and described it is we go into the most critical part of a hospital And we, go in guns a-blazing, trying to disrupt in the effort of making things better, but disrupting very critical workflows. And it takes a lot of, ambition, a lot of resilience to go in and do that. And I have a lot of respect for anybody who's done it and done it well. And Ivan's product was first to the market, so anybody who knocks down the wall takes a lot of hits, and I have good respect for that. I tried and used SmartFlow in our practice. I worked with Ivan early on and talked about it when I was blogging, and I think it's a great product. My world is the biggest of the big centers, right? Especially ER teaching hospitals. And when we started Instinct, the original principle was we were using something called Cornerstone Whiteboard, which is a kind of a built-in solution like a SmartFlow or Instinct to help with workflow. And I was in a circle with many hospitals using it, which say what you want about Cornerstone's whiteboard. I think it's one of the most powerful parts of it. The limit of it, what it could do but doesn't, is what always frustrated me. Mm-hmm. Besides general user experience issues that are really baked into technology choices from decades ago, it's hard to fault, right? And so our original principle was, how can we help these hospitals that can't go to SmartFlow because of whatever reason, integration, their ties. And so we started this for these centers, and that was really the founding principle behind it.
That's really cool. So Caleb, it's hard as hell starting a company. It's also pretty difficult to be an emergency veterinarian. Is there any correlation between what you've learned in emergency veterinary medicine and being a startup tech founder?
Yeah, I think you need a lot of resilience to do this, right? And emergency vets are, we're built to be resilient, or you can't do it. The emergency rooms, I still practice, by the way, about one day a week, which is, pretty important to me, and I think to the product actually. But the resilience that you learn as a CEO, founder, that you need to learn to go through, you're kind of built for, which is kind of nice. Leadership too, which carries its own kind of loneliness and burden. You learn in the emergency room. I mean, you have to be decisive to be a good leader. It's just one of the kind of founding principles. And if you're not decisive when an animal's crashing, you're not going to get anywhere. And that kind of leadership you learn in the emergency room pretty well.
Yeah, Caleb, that's really cool, and I totally agree with you. And the similarities, I think, is because we apply to technology and innovation the same sort of scientific thinking, if you will. And if I would quote the lean startup where everything is build, measure, learn,
Mm-hmm.
that's really how any experiment is put. So that's I think a huge similarity. Is just in emergency, you do experiments really fast. You need to treat the animal, understand very quickly what's going on, and then iterate. I think that's actually sort of the correlation. I think that's why we're maybe better built from ER to startups. So talking about scientific sort of thinking and principles, I know that Instinct took more angle on the medicine rather, well, maybe also on the workflow, but I think that more than SmartFlow took on the sort of medicine and some sort of predictions and drug correlation. Can you tell us more about those features and what was so unique about them?
I kind of lump everything like that into something called decision support, and I think it's a big part of what we're doing. Yeah. Have you heard the phrase, the humanization of pets, in our market? It's something I heard a while ago. And I think our industry and human medicine too, by the way, needs someone to help with what I would call the humanization of computers.
I love it. That's totally awesome.
It's what our focus is. I read and study a lot about where human health got to with their software situation. And backing up, we have a lot of challenges in our industry. And I always say, if I thought a tire would fix these challenges, I would be trying to innovate tires. But I truly believe software, technology, but mostly software, high quality software, has the unique ability to actually help with some of the challenges that we're facing as an industry. And we're focused on that. We're focused on kind of achieving, workflow bliss in complicated environments like advanced care centers, making the computers friendlier to humans, in a way that gives them time, not steals time, but also, like you said, Ivan, helping them make better decisions, not get in the way or worse, lead to dangerous ones is one of our big focuses. And so, we're talking about things that I haven't ever seen in veterinary software, at least, and in my human health, circles with friends, sometimes novel there even. And, those are things like completely integrating reference tools like Plums at the point of care, developing a robust patient safety warning system with a medical team, developing the content behind it so that when you go and overdose a patient, Instinct steps in and says, hey, are you sure you want to do that before you do it? And these are kind of, some of the founding principles behind what we're doing.
So Caleb, a year and a half ago, 2 years ago, as a tech startup founder, I learned about this concept of user interface design, UI, UX. And one of our early ads to our team, and actually one of the founders of our company, is a UI UX guru strategist, to the point where he could just talk to you about this all day, every day for weeks or months in a row. How do you view the importance of user interface design and UX UI design?
Yeah, it's something I've found that not only do I love thinking about, I think our team has gotten really good at it. There's a quote I read yesterday from somebody I follow, and it sums it all up, and I'll read it. It says, in my experience, the great software companies are run by single-minded people who bend the physics of design to their will, creating powerful leverage for those that they serve. They're craftspeople, impatient with the status quo and eager to make things better. And, at the heart of what we're doing with Instinct, it is really about that, which doesn't sound too novel or differentiating, honestly. It sounds like a commodity, but it's not in our industry. There are very few pieces of software that really are using those principles. And so we're focused on all things user-centric. Our team, everybody is infused with user experience, user interface skill set. Even our lead backend, director of engineering used to be a UX designer, which is really weird for a backend engineer. And, that to us means things like complete integration with other systems. It means reference tools, intelligent kind of warning systems, like we said, predictions over finances. We actually do some predictive things, which are really interesting. Extracting data and kind of serving it back at the point of care, and not stopping with workflow in that effort. We'll go where it takes until this problem's solved. And it's that humanization of computers, like I talked about. Data's talked about a lot, and I think it's interesting, right? Being able to pull data out of applications and doing research or whatever you would want to do with data. It's also one of the reasons why we called the company Instinct. Because if you can help a lot of people, there are some really interesting things you can do to give back to the profession through data. But to us, it's more about what we call thoughtful automation. That's what Instinct is to us. And my belief is the way to improve things through data, one day, is actually by laser focusing on helping the user at the point of care. And like a good example of that is, look at what the founders of Tesla or Impossible Meat, if you know those brands, look at what they did and really think about it. They realized to change the world, you have to show how these solutions do amazing things for the individual first. They were smart enough to realize that. And then, oh, by the way, you're making the planet exorbitantly better. In Tesla's case, that was, don't make a Toyota Prius if you want to save the world. Build a car that is actually, the safest, fastest, rivals any sports car in the world. And oh, by the way, you're saving the planet. In Impossible Meat's case, they have an interesting story. Their goal is to make meat that tastes better than meat, but it's not from animal products, which is, a really different approach to who you're trying to serve. And it's really smart. And I think there's a little of that behind how we think of user experience at Instinct.
Okay, so rapid fire questions, because we're running out of time. I got two back to back. What's your ideal customer look like? Just because some of them are probably listening. So describe your ideal customer.
Yeah, I mean, when we started this company, it was laser focused on, being the best out there for teaching specialty ER, the big centers. And we've definitely built a name for ourselves there. But any practice that, has 2 to 10 doctors, busy workflow, struggling with, the mundane tasks that you have through paper. Still, most practices are using paper. That's our main competition. Any veterinarian who's trying to make themselves better through workflow in that range of practices is our wheelhouse.
Makes perfect sense. Now, my favorite question I'm going to get to ask this whole episode is, why would somebody choose Instinct over SmartFlow?
Oh, you did.
This one's for you, Ivan.
He had to go there. Instinct is not owned by IDEX. No, I'm just kidding. That's a joke. IDEX is actually a partner of Instinct. No, it basically Instinct, is focused on, I think, some different things, and it's not stopping with workflow. There, basically the things that we focus on are, like I said, the user experience through predictive analytics, through decision support tools. How we have plums at the point of care, we have safety warnings, and I would say our team behind it explains the best. So we are the only software company I know of out there that is run by a veterinarian and has basically this unique team in-house of half technology experts and half veterinary experts. We have several veterinarians on our team, specialists. We have veterinary students on our team, veterinary nurses, former managers of practices, and I think where we're headed is completely different because of that. We won't just be stopping at workflow.
So, Ivan, I'm going to ask you to ask the next questions and not comment on his answer, please.
I was going to tell a story how, going back to where you practice at the Coral Springs. So I had a pleasure to meet the owner of the practice because I went there to show SmartFlow.
Mm-hmm.
So when I came in, the manager showed me around before visiting the owner of the practice, and she was telling me about many things. And one of them was that they had an MRI outside, as the, like
Mm-hmm.
the 18-wheeler. And then and she was talking about how municipality is, they're really assholes there, and they've been giving them shit for a lot of things. And one of them just recently was that they didn't have enough mulch, and they actually gave them a fine to the hospital. So I'm coming in, his office upstairs. So I'm coming in, and then the first time I meet the guy, and I was trying to sell SmartFlow to him. So the first thing I do, I come in and I said, "What a beautiful hospital you built here! Really something to be proud of. But I've seen you don't have enough mulch outside. Is that a problem?" It was so good. He actually, it was funny. He liked it. Yeah,
He's a great guy.
Anyway, Caleb, it was a pleasure. Great to reconnect with you. For some listeners that don't know, Caleb actually helped us to go to the first conference for SmartFlow because I didn't have anybody in the States to buy us the device to have wireless internet. So Caleb was the one that actually hooked us up, and we had his blog on our first banner at the Orlando conference. So thank you for that again. And we have two questions that we usually ask from our guests. So one of them is there anything that you read, listened, or watched recently that you would recommend to, as Shawn referred before our show, guesseners? I think it's his new word for guests and listeners.
Sounds really Canadian.
Man, there's going to be a war.
Yeah, I get a lot of questions about how a veterinarian, turns entrepreneur. And so I think a lot about, what I've read and what I follow to help me with that. One thing is advisors, obviously, to help fill my entrepreneurial holes. But I read a lot. I'm sure you guys have had a lot of great books recommended. So I'll stick to kind of some blogs that have really made a difference for me. So if I was starting this company, I would have, two kind of people that I follow. One is Paul Graham, who is the founder behind Y Combinator out in the Stanford area. But his blog, which is online, has some hidden gems about how to start a startup. I mean, game-changing things that you read that and you're going to be more informed than most people out there doing it, and it approaches it the right way. And then Seth Godin. One thing I think is pretty different between Ivan and I is I'm bad and drawn away from marketing. And I think, Ivan, you're a pretty great marketer. So that's like a hole for me. But Seth Godin has helped me with marketing and really, understanding what that means to, connect what you're trying to do to your tribe. And I think anybody would be well served to follow those two.
Yeah, I think, you know what, I think we're actually on the same page there, because Seth was one of the authors that I actually have I think every single one of his books because I love that guy. So yeah, so
Mm.
great recommendations. We also ask if you know anybody that we should invite to this show so other listeners can enjoy the podcast.
Yeah, I think there are so many people you guys haven't had, so we can do it after this. But I'll give you one that I think is pretty unique. Beth Davidow. So Beth is a critical care specialist in the Seattle area, and she is a great thinker on all things consolidation, women leadership in veterinary practice, and medical safety. And she's just a great person and a great thinker. So I think you guys should have her on.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.